guys, so we're going to go over the upper quarter neurological screen. So for this, we're assessing the neurological function of the upper extremity, specifically the brachial plexus. So we're looking at the nerve roots of C5 through T1. So with this, it's done pretty much at the end of the evaluation process. So this is after you've ruled out all of your major musculoskeletal issues, and you're just kind of following up to assess the neurological status of everything. So with this, there are three parts. First are your dermatomes, then your myotomes, and then your reflexes. So your dermatomes are an area of cutaneous sensation that correlate with a specific nerve root on the spinal level. So to assess this, looking at C5 first, that's going to be your lateral upper arm, okay, your deltoid region, okay. Getting into C6, we're now looking at the lateral lower arm, as well as the thumb and index finger, that first and second finger. C7 is going to be the central portion of your hand or your middle finger. C8 is the medial lower arm, as well as the fourth and fifth finger, and then T1 will be your upper medial arm. So when you're testing those, you're just looking, does the patient feel similar sensation on both sides, and is it within their normal limit? For your myotomes, these are specific muscular actions that correlate with these spinal nerve roots. So to do that, you're going to do what's called a manual muscle test. So the purpose of that is to have them perform a particular muscle action, and you are going to try and inhibit that muscular action, and they should be able to resist it. So for C5, we're looking at shoulder abduction. The easiest way to do that is to bring them up here, have them hold that position while you push down, so they should be able to resist your force, okay? An indication of a positive test would be if one side drops, okay, they don't have that sensation, they cannot perform that action. For C6, we're looking at elbow flexion, so I'm going to have the athlete go into a bicep curl, and I'm going to try to resist that. You can do it on both sides if you want, or you can stabilize the arm and just do it on the one side. For C7, we're looking at elbow extension, so have the athlete stand up, okay? And then they're going to go down into that elbow extension. Okay, same thing, you can do it on both arms, or if you want to stabilize one, you can do that. Okay. C8, we're looking at opposition. So that's your thumb coming across to meet your fifth digit. So one, they should be able to do that. Okay, but then to resist the action, you want to have them hold their thumb to their fifth finger, and you're going to try and pull that apart. Okay. Obviously, it's just the fingers. It's not a super strong muscular action. You're going to be able to do it, but you should be able to feel them resist that action. You can hop back up there. T1 does not have a myotome. Okay, so we're going to skip that. We're going to move down to reflexes next. So these are looking at the deep tendon reflexes. So for this, you're going to invoke an action on the actual tendon, and you're looking for that really instantaneous reflex action. So C5, you can come over here. C5 is looking at the biceps tendon, okay? So on your smaller athletes, this is going to be a fairly easy tendon to find. It's right in the center of the elbow, but if you can't find it, have the athlete go into a bicep curl, resist it. That tendon is going to pop up right in the center, okay? So for this, you want the patient to be completely relaxed, so just figure out a way to hold their arm, okay? I'll just do it like this for the camera here. Okay, so she's nice and relaxed. I'm going to put my thumb over her tendon, and I'm just going to come in here, and I'm just looking for that reaction, okay? C6 is brachioradialis, okay? So the wrist needs to be in neutral for this muscle. If you're having trouble finding it, put them in wrist neutral, have them do a resisted bicep curl, okay? It's the big guy here that's going to be popping up. So you can kind of do this reflex anywhere through here. Again, you want them nice and relaxed. You can do this directly over the tendon or over your thumb, whichever you prefer. You're just coming in here. Okay, again, looking for that reaction at the elbow area. C7 is going to be your triceps brachii. Okay, so for this, you want to be behind the patient. You're going to bring their arm out, again, making sure they are in a relaxed position. Find that tricep tendon. If you're having trouble finding it, have them come out, do a resisted tricep extension. Okay, that tendon's nice and big. It's going to pop up right above the olecranon process here. And again, same thing, going over the tendon, just looking for that reaction here. Okay, I'll do it one more time for you guys. Okay, just like that. So that is your upper quarter neurological screen. Again, you're doing that at the end of your orthopedic exam, just following up, assessing the neurological function of everything in the upper extremity, or if during your exam you do notice some sort of neurological deficit.